today's workshop. First, we will have the Employee Benefits Trust meeting. Today is July 18th, 2024. It's currently about 10 minutes after 1. And so item number 1 is consider adopting a resolution authorizing the purchase of employee insurance policy from the following vendors for fiscal year 2025. A, medical and pharmacy insurance plans from Blue Cross Blue Shield of Texas in Richardson. Item B is dental insurance plans from Blue Cross Blue Shield of Texas of Richardson. C is vision fully insured insurance policy from Dearborn Life Insurance Company. Dearborn is a subsidiary of Blue Cross Blue Shield of Richardson. Hey. Sorry. Next is flexible spending account, dependent spending account, cafeteria 125 plan, health savings account, administrative services, and consolidated omnibus budget reconciliation act administrative services from Optum Financial of Hunt Valley, Maryland. Basic life, voluntary life, accidental death and dismemberment, short-term and long-term disability insurance from Dearborn Life of Richardson, and accident, critical illness, and hospitalization insurance from Standard Insurance Company of Portland, Oregon. Ms. Raymond.
Yeah.
Longest item agenda ever.
Good afternoon, everyone. So I'm supposed to just give a brief overview of the benefits just mentioned. These are the benefit plan types we'll be discussing today. So we have our medical and prescription coverage, dental, vision, we have basic life and accidental death and dismemberment, long-term and short-term disability plans, FSA, HSA, COBRA, and then we have the accident, critical illness and hospital. So for our medical plan, we're recommending that we renew with our current vendor, which is Blue Cross and Blue Shield of Texas. We have one high deductible plan that has an HSA attached to that. We have a PPO plan as well. This plan is paid for by both the employer and the employee. We last conducted an RFP for medical and pharmacy back in 2022. Both of these plans are nationwide network provider plans, meaning that there's providers throughout the United States that employees can see. There is a premium increase proposed overall. There will be no increase to the employees that are in the high deductible health plan. There will be an increase that will be shared by both the city and employees for the PPO plan. The maximum increase that will be realized is $135 a month for employees that are in the family plan. We did negotiate the rate renewal down. It originally was going to be significantly more of an increase, but we were able to negotiate that down by making some plan changes and also by bundling our vision, dental, life, and disability products with the same vendor. We received discounts for that. So we were able to minimize the increases that way. The plan changes that are proposed are to the PPO plan, and those are an increase in the deductible and the out-of-pocket maximum on that plan. So that's the plan changes that are proposed. So I wanted to just give everyone a historical view of what the premiums for both the employees and the employer looks like over the past 5 years or so. On the far right, you'll see what's proposed for FY25. So the highest increase you'll notice is the employee and family. It's going up to $815 from $700. Back in 2022, it was at $900. So we still, even with this increase, are not back to the premium levels that we had seen even 2 years ago, because we did have a decrease in premiums in FY23. And that's both on the PPO and high deductible plan, where we were able to give decreases. So back in 2019, if you look all the way to the left of that column, you'll notice that the premiums were significantly, again, more than they are proposed to be in FY25. This just shows you on a chart what that kind of looks like. So the yellow line is the family plan. The employee and children is the line below that. Then you'll see the employee and spouse and the employee only. When you look at that, you can see where we started back in 2019, and we are still below what that year was. The employer is a little bit different, because as we've seen some premium increases over the last several years, the employer has picked up some of those. So some of the increased prices, what you see today, like for FY25, you'll notice that the city is actually contributing more than they did back in 2022 or even back in 2019. The city is picking up more of those premium increases and not passing that all along to the employees when those occur. So I get asked the question of why do premiums increase? And I think a lot of people know, but I always like to just put it out there that one of the reasons that the premiums increase and how they give you your premiums each time that we go every year and ask for what the premiums will be is based on the usage of the plan in big part, right? So we have had a couple of years with several high claims, and those really big claims drive the cost. And that cost then drives our premiums up. So that's how that happens. This is just the trend for the employer. So you can see where we were back in 2019 as far as the city side, what's being contributed there and where we are today. One thing I want to mention, it's not in my presentation before I go on to the next slide, is about the Blue Cross Blue Shield and Scott and White current contract negotiations. We still don't have a final contract. They have extended that till October 1st. We have been told by both sides that they are both confident they're going to come to an agreement. I know that makes a lot of people nervous. I always equate it kind of to when you turn your TV on and the cable channel says, contact your provider because we're going to cancel our contract. You're not going to be able to watch HBO or CNN or whatever the channel is. And it's because they're negotiating the terms of their agreement. So that is what's currently happening with Scott and White and Blue Cross at the moment. Again, they're both confident that they'll reach an agreement. I have been asked, well, what's the worst case scenario if they don't? Our contract and agreement with Blue Cross does allow us to cancel that plan with a 30-day notice. If it came to that and Blue Cross and Scott and White had to sever ties and they were not going to be partners anymore and we couldn't send employees there anymore, they're our biggest medical provider in the community, we would have the option of doing that and going out for RFP and finding another. Again, I don't think that's likely because when you think about those two corporations, they mutually need each other. They really do. You know, Scott and White has a lot of Blue Cross members that come to them, and Blue Cross, on the other hand, needs Scott and White. So it would be highly unlikely. And in my years, and it's over 20 years of working with benefits, I've seen lots of different medical insurance providers, including Aetna, United over the years, who are contracting with the local hospital, and these things do happen. And I haven't had one that I can remember that severed ties and never got back together that was a huge insurer.
Just a point, TIC for years has offered Scott and White and Blue Cross Blue Shield side by side, you know, in multi-option. And they, Blue Cross Blue Shield is the only provider this year. So that adds to the fact that there's a little bit more incentive, right? Because they're picking up another group. So they'll work it out.
A little bit more incentive that they will work it out.
Yes.
Yeah, because they would lose all of the TISD employees too.
Yeah.
if they did. And we're sending out, you know, as we get any information, we are sending out and keeping employees updated, sending the emails, even when there's not information. I'm still trying to send emails every couple of weeks and say, I don't have new information, but here's what's going on, and we're staying on top of it. So our dental plan, we're recommending a renewal with Blue Cross and Blue Shield. There's no rate increase. We still have a 1-year rate guarantee remaining. So we're recommending staying with the same 2 plans. We did enhance those plans. You might recall last year when we switched over to Blue Cross to provide for a higher benefit for employees, and everyone has been pretty happy with that. We haven't had For vision, we're recommending switching from our current standard plan, which runs on the VSP network, over to Dearborn, which is a subsidiary of Blue Cross and Blue Shield. They run on the iMed network, which is still a very strong network for vision benefits. There's no rate changes or increases for our employees on this plan, and there's a 4-year guarantee for the rates. For our basic life, AD&D, and supplemental life, we're recommending a new vendor. We currently have standard. We're recommending moving that over to Dearborn, again, the subsidiary of Blue Cross. We'll keep the same plan types that we have today. There's no change in those plan types. There's a rate decrease on the basic life and accidental death and dismemberment. And along with the rate decrease, we were able to get an enhanced benefit. Our current benefit is employees receive 1 times their annual salary up to $100,000. That's the basic life that's provided at no cost to employees. We were able to increase that to up to 175,000. So employees making over that 100,000, there would be more coverage for that for the life insurance. The voluntary life, that's paid for by employees wholly. The city doesn't pay that. There is no rate increase for that with the new plan, and we get a 3-year rate guarantee. And so the rate guarantees just basically means we can renew for 3 years and they won't increase our premiums. For disability, we also are recommending moving over to Dearborn, keeping the long-term plan, and we have 2 short-term disability plans. That's how we've historically had them. The difference in those is the run out period, they call it, how many days you have to be out before you can get the benefit. One is a 7-day plan and one is 14. One of the employees choose that when they enroll. That is wholly paid by the employees, with the exception of the short-term plans that are paid by the city for executives. That RFP was just conducted this year in 2024. No change in the benefits. There's a rate decrease that will be employees will enjoy with that one, so they're paying a little bit less if they have those plans, and we have a 3-year rate guarantee on that. The FSA, HSA, and COBRA, we did go out for RFP on this one. After reviewing all the RFPs and scoring everything, it was determined we would stay with our current vendor, which is Optum Financial, that would be the best option for the city. There's no rate increase for that, and we don't have a rate guarantee left. So next year when we get the renewal price, if that is not something that is advantageous or what have you, we'll be going back out for RFP. For additional insurance, we do offer accident, critical illness, and hospital indemnity plans. Those are paid wholly by the employees. We still had a rate guarantee with Standard, so we are recommending using our last year rate guarantee for that. And so there will be a change in vendors there, and there's no change in the benefits either. So today we're asking the Benefits Trust to adopt the resolution authorizing the benefits for FY25 as presented. I'm happy to answer any questions or go back to anything you'd like to look at.
Very good, thank you. Trustee members, any questions for Ms. Raymore?
I had one question. On the first slide, medical, there were increases shown. In the other, did you have other bids?
This one did not go out for
It
RFP.
did
It was
not
a
go
renewal.
out. Okay, so there's no way to compare the increases to see if other bidders or other insurers are similar increases.
No, but we did analyze everything and expected there to be an increase of upwards of 30% because over the last 2 years, last year, our claims experience, by looking at that, we should have gotten about a 20% increase, but we had a rate of 9%. And this year we were trending at a 15 to 20% increase in claims. So we were expecting around the 35%, and we were able to keep it at 19.1.
Good difference. Thank you.
Very good. Anything else? Thank you, ma'am.
Thank you.
All right, trust members, if there are no questions, then I'll entertain a motion to approve item number 1 as I read in earlier.
I'll move to approve.
We have a motion by trust member Walker. We have a second by trust member Pilkington. All those in favor state aye.
Aye.
Opposed, same sign. Good. Motion passes 5 votes to 0. It is 1:23 and we'll adjourn the